So today I have my client here. His name is Kevin. He is 23 years of age, and prior to this discussion, I did have him fill out the questionnaire and also the health status. So here I've had him fill it out. He's also signed down at the bottom. So now I'm just gonna go over with him what exactly his risk stratification is and also his answers on his pre-screening questionnaire. So, based on the Part Q, he does not have any of the following symptoms, or he answered no to all of the questions. And so, therefore, he has nothing to worry about in that part. We don't have to even talk about that. And the next part the next part of the questionnaire was just assessing his health status and his history. He has no history, he has no symptoms either, and he doesn't have any other health issues such as diabetes, asthma, or things of that sort. Now, as far as cardiovascular risk factors, he did mark yes or true to a few of them. He marked true that he does not know his cholesterol level, that he is also physically inactive, meaning he doesn't work out the appropriate 30 minutes a day for at least 3 days a week, and also he is 20 pounds overweight. Based on these answers and based on the question, the answers that he'd given me, I looked at the risk factors, and he does have two positive risk factors, so that automatically puts him into the moderate risk. So basically, what it's saying that you are at moderate risk for a heart for some type of cardiovascular um, problem. The reason for the pre-screening questionnaire that I gave you is so that we know where you fall, to start you off on an exercise program and just to see what exactly you can and cannot do. Now, like I said earlier, you did fill out this questionnaire. You answered no on all of the Part Q questions. And then also about your health status, you have no history, no symptoms, and no other health issues, meaning like you don't have a disease, you don't have chest pains, you don't have breathing problems. But like I said, the cardiovascular risk factors, so meaning your heart, things of that sort that could affect you as far as disease-wise, you did answer a few of those. So we need to see exactly what could affect you when you're going to do an exercise. So if you cannot physically do something, this is going to tell us. And it gives us a baseline as to where we can start to build your exercise testing and also your exercise plans. He is at risk for cardiovascular disease. And I also calculated his BMI. I took down his weight and then calculated it into kilograms. And then I also took his height and then calculated that into centimeters. So his BMI right now is 36.86. Now he falls into the obese category, meaning that he is overweight in comparison to the chart that is given into the ACSM guidelines textbook. So we're going to talk about the risk stratifications, and I'm going to explain to the client exactly where he falls. And he is at moderate risk. Like I said, he has two risk factors, which was he was overweight, meaning he weighs over the standard weight guidelines, and then also he is sedentary, so meaning he does need to do some type of exercises for at least 30 minutes a day, whether he starts at walking and then progresses to an exercise program, or he finds something that he really enjoys, but just something 30 minutes a day for at least 3 days a week. That'll get him into the active category. Now, as far as does he require a medical exam before exercise testing? No. So basically, if you wanted to do some type of exercise program, you don't need to have a doctor's supervision. So you can go ahead and do it. But you should still make sure that you are doing something appropriate for you. Now, as far as supervision of the exercise test, again by a doctor, you don't need that. And that's for moderate exercise. Now, if we're talking about vigorous exercise, it is required because you don't want to do something that your body cannot handle. So, say you want to run 10 miles straight. You cannot do that because that could cause some kind of problems for you. It might cause you to injure yourself or feel sick or dizzy or just things of that sort. And also for exercise testing, if you're going to do a one repetition max, which means you can only do one repetition of this weight. So if you're going to do a bench press, and that's the exercise where you're lying down and you have the bar with weights set on the side, and you can only do one of those, you will need a doctor to supervise you for that. And that's again just for your safety, your health, and that's just the risk stratification that you do fall under.